Osteopetrosis and Erlenmeyer-flask deformity. Osteopetrosis is a bone disease that makes bones abnormally dense and prone to breakage. Erlenmeyer-flask deformity refers to a radiographic appearance, typically on a femoral radiograph, demonstrating relative constriction of the diaphysis and flaring of the metaphysis.
This is a young patient who presented with neck pain. Frontal and lateral radiographs of the cervical spine were obtained. These radiographs demonstrate no evidence of fracture or evidence of degenerative disease. However, the bones have a diffusely sclerotic appearance with thickening of the cortex. As part of this patient's workup, a third radiograph of the pelvis and proximal femurs were obtained. The third radiograph demonstrates diffuse sclerosis of the pelvis and proximal femurs. While the differential diagnosis for diffusely sclerotic bones is broad, this patient had a metabolic bone disease known as osteopetrosis. In osteopetrosis, there is malfunction of cells known as osteoclasts, which are responsible for bone resorption. The bones become too dense. However, the bones are also at risk of fracture and dissolution. Other complications include anemia, infection, and multiple cranial nerve palsy secondary to increased osseous expansion of many of the neural foramina of the skull base.
It is caused by a failure of osteoclast differentiation or function, and mutations in at least 10 genes have been identified as causative in humans. Osteoclasts are highly specialized cells, which degrade bone mineral and organic bone matrix. These processes are crucial for bone remodeling and the maintenance of bone biomechanical stability and mineral homeostasis.
So here we have an image and the classical appearance. We see that this is a vertebra and we see a smaller vertebra within it. So we have a small vertebra and a larger vertebra. So this is the bone within bone appearance which is seen in osteopetrosis. Osteopetrosis, the term itself means osteo means bone and petros means stone. So the bones in osteopetrosis are like stones, that is they are sclerosed because osteoclasts are defective in osteopetrosis. This is a MCQ asked. In osteopetrosis, it is dysfunction of osteoclast and not osteoblast. That is why the bones are sclerosed. So this image shows all the features of osteopetrosis. We see that there is widening of the diploic space, especially the skull base, which leads to compression of the cranial nerves and hence symptoms like visual complaints and deafness. In the vertebra, you see the sandwich appearance, that is the end plate sclerosis, that is sandwich sign of osteopetrosis, again the sandwich sign. The bones are dense, diffuse osteosclerosis. The medullary cavity is also involved. That is why there is anemia, thrombocytopenia, and there is extramedullary hematopoiesis leading to hepatosplenomegaly. And we see bone within bone appearance here. And there is metaphyseal flaring, that is called Erlenmeyer-flask deformity seen in femur. So these are the features of osteopetrosis, which is also called Albers-Schönberg disease or marble bone disease.
Acquired bone disease, including primary bone marrow disorders, heavy metal poisoning, bone metabolic diseases, and other dysplasias. The delineation between osteopetrotic and normal bone suggested a period of increased bone turnover followed by improved bone growth. This finding is more consistent with bisphosphonate exposure than with an underlying genetic condition.
All right, let's talk about osteopetrosis. Osteo means bone, petrosis refers to rock-like. So this is a disorder in which you have abnormally thick, heavy bones. It's an inherited defect in bone resorption. Now, if you remember, bone formation is a balance between osteoblasts, which lay on bone, and osteoclasts, which resorb bone. Now, this balance is constantly occurring throughout life so that you're always laying down some bone and always resorbing some bone. Now, a defect in bone resorption in which you're constantly laying down bone but can't resorb it results in an abnormally thick and heavy bone. Now, despite it being abnormally thick and heavy, it fractures easily. Think of it like a piece of chalk. A piece of chalk is thick, but you can easily crack it. Now, this disorder is due to poor osteoclast function. It has multiple genetic variants. Most important is the carbonic anhydrase 2 mutation, which results in a lack of acidic environment that's required for bone resorption. An acidic environment is necessary in order to remove calcium to resorb bone. Now, in order to generate an acidic environment, the enzyme carbonic anhydrase is necessary. Carbonic anhydrase combines water and CO2 to make up H2CO3. Carbonic acid then breaks up into a proton and bicarbonate. Now, this proton, which is the acid, leaves the cells, and this is what creates the acidic environment necessary for bone resorption. If osteoclasts don't have the ability to generate this acidic environment, they won't be able to resorb bone, and this is exactly what occurs in the carbonic anhydrase 2 mutation. The clinical features of osteopetrosis include bone fractures. Now remember, although the bone is thick, it's going to be very weak, hence it's more prone to fractures. And this is because there is no proper balance between the osteoclasts and osteoblasts. And in order to make strong bones, you need to have a balance between the osteoclasts and osteoblasts. Patients can also have anemia, thrombocytopenia, and leukopenia. So now this occurs because the thickening of the bone replaces the medullary space, which is called a myelophysic process. Myelophysic process which knocks out the ability for hematopoiesis. Hematopoiesis, which means generating blood cells. So if hematopoiesis is knocked out, individuals end up with anemia, low red blood cells, thrombocytopenia, low platelets, and leukopenia, low white blood cells. These individuals end up with extramedullary hematopoiesis, so this blood cells are going to be made outside of the bone marrow, either in
Ecuador, due to the lack of instruments, exams, and other methods to diagnostic this disease, the prognostic of life is low. People have to go to other developed countries to pay for the proper exam to diagnostic osteopetrosis, among other bone diseases. A total of $10,000 consisted of the genetic exam and control exams, aside from the pharmacology treatment, which consists in $200 for 15 millimeters of calcitriol each day. This disease affects 1 of 20,000 people.
Okay, a neonatal chest X-ray is in front of us. A normal neonatal chest X-ray, and I want you to look at the ribs and the other bones that are visible. Notice the normal bone density. There is a degree of radiation absorption within the bones as always, but some of the radiation is able to pass through, creating a unique appearance that makes you differentiate between bones and surroundings. You can see there are objects on this X-ray that have absorbed nearly all of the radiation generated by the X-ray machine. These objects appear more opaque. For example, this left metallic marker and this cable here on this side. You can also see areas that have absorbed far less radiation as compared to bones. For example, air in lungs, in intestines, and in stomach. But for now, I simply want you to keep normal bone density in mind. The X-ray in front of us is an example of normal left proximal femur in an adult person. There is a very clear corticomedullary differentiation. You can even measure the thickness of the cortex on both sides. This is medial cortex, this is lateral cortex, and in between there is a cavity that is known as medullary cavity. In that cavity, of course, is filled with lipid-rich yellow bone marrow and clearly has a different density than the cortex visible on two sides. Keep in mind that the bone surrounds the cavity from all sides, of course, but this is the pattern that you should see if the bones are normal. Also notice that remodeling of bones as if the artist who created them was very professional in creating the perfect shape that he wanted to create. Let's look at another femur x-ray in a child. Again, normal bone density, and there is a very clear corticomedullary differentiation. This is the medial cortex, this is the lateral cortex, and there is medullary cavity in between. Now look at this chest x-ray. Look at the ribs, posterior ribs, anterior ribs, long bones, and the other bones that are visible. Notice the bone density is abnormally high, as if there is a high amount of calcium within the bones. There is also a poor remodeling of ribs and other bones, especially the costal ends of the ribs, which are anterior, do not look normal. Notice the similar finding in long bones. There is a loss of corticomedullary differentiation. You cannot differentiate between cortex and medulla. The condition is known as osteopetrosis. The loss of corticomedullary differentiation is because of increased cortical thickening and medullary stenosis. Osteopetrosis is a term used for a range of sclerosing bone conditions arising from the defective function of osteoclast or even from the absence of osteoclast. Osteoclasts are large multinucleated cells that are responsible for breakdown and reabsorption of bones. And I'll make another video on remodeling of bones that will describe osteoclast and function of osteoclast. But for those who do not know, bone is a dynamic tissue. Radiologically, osteopetrosis is identified by abnormally high bone density and abnormal bone remodeling. One might think that these bones should be very strong, but reality is exactly opposite. These are very brittle bones that are very easy to fracture. The topic is very broad, which is clearly beyond the scope of this small video, and also the list of conditions that can cause diffuse osteosclerosis other than osteopetrosis is quite long. And the purpose of this small video is to describe the most common radiological features of the condition known as osteopetrosis. Another very good example of osteopetrosis, you can see increased bone density and loss of corticomedullary differentiation. The X-ray shows another interesting finding. This boy has inguinal hernia. You can see intestines within the scrotal sac with air and fecal material within it. So the black density, of course, is air, and it is surrounding the fecal material. Thank you very much.
In conclusion, these conditions vary greatly in their presentation and severity, ranging from neonatal onset with life-threatening complications such as bone marrow failure to the incidental finding of osteopetrosis on radiographs.
In this case, we have x-rays of the pelvis and the right hip. And you can see these are very old x-rays from our archives because this is a very unusual disease called osteopetrosis. It's also known as stone disease or marble bone disease. It's an extremely rare inherited disorder where the bones harden and becoming denser. So you can see that there's extreme remodeling and deformity of the bones, and they're really dense and sclerotic. And that's what you see in patients with osteopetrosis. But of course, in real life, you most likely are never going to see a case of this. The bones, even though they become sclerotic, they're less dense, so they're brittle, and they actually have osteomalacia, and they get soft. And so that's why you see the deformity as well as the sclerosis.
Thanks for watching.